Most people think stroke risk builds during the day. They blame stress, salt, high blood pressure, long work hours. But what if one of the most dangerous hours for your brain isn't when you're awake at all? What if the way you sleep tonight is quietly putting extra strain on your blood vessels while you're unconscious? And what makes this so dangerous is that it doesn't feel dangerous. It feels normal. It feels comfortable. It feels like the same sleeping habit you've had for years. But if you snore, wake up with headaches, sleep flat on your back, or go to bed right after a heavy meal, you may be creating the exact conditions that make nighttime blood pressure swings, oxygen drops, and poor circulation more likely. I'm Dr. David Wilson, and in the next few minutes, I'm going to walk you through 5 nighttime sleep habits ranked from risky to most dangerous, especially if you're over 50, dealing with high blood pressure or already have heart or circulation problems. But more importantly, I'm going to show you the 2 sleep setups I recommend instead, the ones that can support better breathing, steadier circulation, and less strain on your brain while you sleep. Before we start, I want you to do one thing. Comment below, back sleeper, side sleeper, or stomach sleeper. Because there's a very good chance your current habit is somewhere on this list. And if it is, you need to know before you go to bed tonight. Let's start with number 5. Number 5, sleeping with your head propped up on too many pillows. Now, I know why people do this. They want to breathe better. They want to reduce reflux. They want to feel supported. And yes, a little elevation can help in the right situation. But stacking 2, 3, or 4 pillows under just your head can create a different problem entirely. It pushes your head too far forward. Your chin drops toward your chest. Your neck stays bent for hours. And that changes more than comfort. It can narrow your airway, increase neck tension, and leave you waking up with a stiff neck, dull headache, jaw tightness, or pressure at the base of the skull. Here's what most people miss. When your neck is bent too far forward all night, you don't just feel sore. You may also breathe less efficiently. Your posture becomes compressed. Your upper airway can get more crowded. And if you already snore or have mild sleep apnea, that bad pillow setup can make it worse. So if you wake up feeling unrested even after 7 or 8 hours, don't just blame age. Look at your pillow height. A properly supportive pillow should keep your neck neutral, not folded forward. One good pillow is usually better than 3 bad ones. Now, number 4 gets even more common. Number 4, sleeping on your stomach with your head twisted to one side. This position feels cozy to some people. It may even help you fall asleep faster. But from a cardiovascular and breathing standpoint, it can be a problem, especially over time. When you sleep on your stomach, your neck is forced into rotation for hours. Your chest is pressed into the mattress, and your lower back often stays arched in an unnatural way. That combination can make deep breathing harder, especially if you're older, carry weight around your abdomen, or already deal with shoulder, neck, or back pain. And when your breathing is shallower, your sleep quality drops. You may not fully wake up, but your body notices. Your nervous system notices. Your heart notices. That's why some stomach sleepers wake up exhausted, foggy, achy, and still think they slept all night. You were in bed all night. That doesn't mean your body recovered all night. And here's the other issue. If your neck is twisted in the same direction every night for years, you create chronic tension patterns that can contribute to headaches, shoulder numbness, and poor morning mobility. So if you are a stomach sleeper and you keep waking up feeling tight, heavy, or unrested, this may be one of the biggest hidden reasons why. But number 3 is where breathing starts to matter even more. Number 3, sleeping in a tightly curled fetal position. This one surprises a lot of people because it feels safe, protective, natural, and in moderation, side sleeping can be excellent. But the problem is not side sleeping itself. The problem is curling too tightly. Knees pulled high, chin tucked down, shoulders rounded in, back flexed. When you sleep like that for hours, you reduce how freely your rib cage expands. Your breaths can become smaller and shallower. And if you already have heart disease, lung issues, anxiety, or poor sleep quality, that reduced expansion matters. Maybe not once, but night after night, year after year, it adds up. That's why some people wake up feeling like they can't take a full breath first thing in the morning, or they sit up and feel stiff through the upper back, or they feel mentally cloudy for the first hour of the day. They think they need coffee. Sometimes what they really need is a less compressed sleep posture. If you sleep on your side, that can be a very healthy position. But let your body stay longer, not tightly folded. A pillow between the knees can help. A body pillow in front of you can help. The goal is support without collapse. Now, number 2 is one of the most overlooked habits on this entire list. Number 2, going to bed too soon after a heavy meal, especially if alcohol is involved. This is where many people unknowingly create the perfect storm. They eat late, they sit for a while. Maybe they have a couple of drinks, then they lie down within an hour or two and expect their body to rest. But your body is not resting, it's working. Digestion demands blood flow. Alcohol can disrupt blood pressure regulation, worsen snoring, relax the airway, and fragment deep sleep. A heavy meal can increase reflux, pressure in the abdomen, and nighttime discomfort. Put those together and you may get more tossing, more oxygen disruption, more blood pressure instability, and more strain on the heart during the very hours when your body is supposed to be recovering. This is especially important if you already snore, have high blood pressure, atrial fibrillation, diabetes, or sleep apnea, because in those people, late eating and alcohol don't just disturb sleep. They may magnify the exact conditions that make nighttime cardiovascular stress more dangerous. And here's how this often looks in real life. Someone says, "I always wake up at 2 or 3 in the morning." Or, "I wake up hot, pounding heartbeat, dry mouth, anxious." Or, "I wake up with reflux and pressure in my chest." They think it's random. It often isn't. Try this instead. Finish your main meal at least 3 hours before bed. If you drink alcohol, give your body more time, not less. And after dinner, take a short walk. 10 to 15 minutes. Simple. That small change can improve digestion, reduce reflux, and help your body settle before sleep. But number 1 is the habit I worry about most, because it combines poor breathing, blood pressure surges, oxygen drops, and hours of repeated stress on the brain and heart. Number 1, sleeping flat on your back when you snore, gasp, choke in sleep, or have untreated sleep apnea. This is the one that deserves your full attention, because the issue is not just back sleeping. The issue is back sleeping when your airway is already vulnerable. When you lie flat on your back, gravity pulls the tongue and soft tissues backward. Your airway can narrow, snoring gets louder, breathing can become irregular, and in people with sleep apnea, breathing may repeatedly pause altogether. Now think about what that means. Oxygen drops. Your brain senses danger, your stress system activates, blood pressure spikes, your heart rhythm can become unstable. Then you partially recover, fall back asleep, and it happens again and again and again, not once, sometimes dozens of times an hour. This is one of the clearest hidden nighttime pathways to cardiovascular damage. Because if your oxygen is dropping and your blood pressure is surging over and over while you sleep, your body never truly enters stable recovery. Your vessels remain under stress. Your heart remains under stress. Your brain remains under stress. And the scary part is that many people don't know it's happening. They just know they wake up tired, or with a headache, or with dry mouth, or their partner says they stop breathing in the night. If that sounds like you, don't ignore it. Snoring is not always harmless. Pauses in breathing are not normal. Waking up gasping is not normal. Morning headaches, unexplained fatigue, nighttime choking, frequent bathroom trips, pounding heartbeat at night. These are warning signs. If you sleep flat on your back and you snore heavily, that is the habit I would change first. So what should you do instead? Let's talk about the 2 better setups. The first is side sleeping, especially if you snore, have reflux, or suspect sleep apnea. For many people, sleeping on the side helps keep the airway more open than lying flat on the back. That alone can reduce snoring and improve breathing. And for people with acid reflux, left side sleeping is often especially helpful because it may reduce the tendency of stomach contents to rise into the esophagus. Now, I want to be careful here. This is not about making people panic over right side versus left side, like there's one magical side for everybody. The bigger win for most high-risk sleepers is moving away from flat back sleeping if breathing is the issue. That said, many people do very well on the left side because it can feel more comfortable for reflux and may reduce that heavy pressurized feeling after a late meal. The key is support. Use a pillow that keeps your neck neutral. Place a pillow between your knees if your hips or lower back hurt. And if you tend to roll onto your back during the night, a body pillow can help keep you in place longer. The second good setup is back sleeping with gentle upper body elevation, but only if back sleeping does not worsen your snoring or apnea. This is ideal for certain people, not everyone. If you don't have significant snoring or airway collapse, a gentle incline can reduce reflux, ease nasal congestion, and help some people feel less pressure in the chest. But the word here is gentle. Not a mountain of pillows under your head, not sitting almost upright. A slight elevation of the upper body, ideally with the torso supported, not just the neck bent forward. And if you use this setup, placing a small pillow under the knees can reduce lower back strain and make the posture more sustainable. So if side sleeping works for you, great. If elevated back sleeping works better and you do not have breathing pauses, that may be a strong option too. The point is not to chase perfection. The point is to stop creating preventable stress while you sleep. Now let's talk about the bedroom itself, because even the right position won't save poor sleep if your environment is working against you. First, keep the room cool. A cooler room usually supports deeper, more stable sleep than a warm one. Second, reduce screen exposure late at night. If your brain is flooded with stimulation right before bed, sleep quality suffers. Third, clear your nose if congestion is a problem. A blocked nose encourages mouth breathing, snoring, and poor sleep quality. And fourth, stop normalizing bad mornings. If you wake up with headaches, dry mouth, brain fog, dizziness, racing heart, or swelling in the legs, don't just brush it off. Your body may be telling you your sleep is not restorative. And if there's one message I want you to remember from this video, it's this: comfort is not always safety. A position can feel familiar and still be working against your breathing, circulation, and blood pressure all night long. That doesn't mean you should panic. It means you should pay attention, because the good news is that some of the most powerful changes are also the simplest. Change your position, fix your pillow, stop eating so late, cut back the bedtime alcohol, take snoring seriously, get evaluated if someone says you stop breathing at night. That is not overreacting. That is prevention. And that matters even more if you are over 50, already managing blood pressure, have diabetes, have atrial fibrillation, or have a family history of stroke. You do not need to change everything tonight. You only need to change one thing first. Maybe it's getting off your back if you snore. Maybe it's stopping the late heavy dinners. Maybe it's replacing those stacked pillows with one supportive pillow. Maybe it's finally taking your sleep apnea symptoms seriously. Pick one. Start tonight. Then pay attention to what changes in the morning. Do you wake up clearer? Less head pressure? Less dry mouth? Less fatigue? Better energy? Your body usually gives feedback faster than you think. Now I want to hear from you. What kind of sleeper are you? Back, side, or stomach? And which habit are you changing first? Put it in the comments, because your answer may help someone else recognize a warning sign they've been ignoring for years. If this video helped you think differently about sleep and stroke risk, Share it with someone who snores, someone with high blood pressure, or someone who keeps waking up feeling terrible for no obvious reason. And make sure you subscribe, because in the next video, I'm going to break down the nighttime symptoms many people dismiss as just poor sleep that can actually be early warnings your heart and brain are under more stress than you realize. I'm Dr. David Wilson. Sleep smarter, breathe better, and protect your brain starting tonight.